And it's time now for our twice-weekly In Focus Health Update. And joining us now is, of course, health reporter Linord Moudou. Hi, Linord.
Hello, Dimiaki.
Some interesting developments about malaria in Tanzania?
Absolutely. Mosquitoes are disappearing.
Wow.
Over the years, experts have linked tobacco to diseases such as lung cancer, but its plants are now being used by Israeli researchers to generate a drug to fight malaria. The researchers used a new method to produce the anti-malaria drug artemisinin from a genetically engineered tobacco plant. The drug is normally extracted only from the wild sweet wormwood plant, Artemisia annua, and cannot be grown as crops. Natural or synthesized artemisinin-based drugs are costly and in short supply. Professor Alexander Weinstein from the Hebrew University's Faculty of Agriculture, Food and Environment heads the research team.
The drug is produced from Artemisia annua. It's a plant that is not actually agriculturally suitable product. So we modified tobacco, and we now have tobacco plant producing the same drug. And this is actually the first time, as far as we know, that this final product was produced anywhere in any system. You can grow a lot of tobacco plants. You know exactly how to treat them in order to produce a biomass. The life cycle of tobacco is very short, so you can produce many generations during the same few months. And you can extract large amounts of the drug in order to really help combat the disease.
And Professor Jacob Golenzer is a malaria researcher at the Hebrew University's Faculty of Medicine. He says the new development may have other advantages in the future.
It's an important step towards a better production of artemisinin, which is very important drug, being an introductory drug to some other derivatives that are nowadays used as a first-line drug against malaria, and probably in the future also against some other diseases like cancer and some parasitic diseases.
Now to Tanzania, where a dramatic reduction in the number of mosquitoes has raised the curiosity of researchers.
Tongoni is a remote village in northeastern Tanzania. Here, generations of children and adults have succumbed to the Anopheles mosquito that causes malaria. But scientists say mosquitoes have all but disappeared over the last 10 years. A possible cause? Climate change, they say. Dr. Melwe Malesela is Director General of Tanzania's National Institute of Medical Research.
Why we think there's a decline in mosquitoes is that there have been changes in rainfall patterns. And particularly in Masaika, these changes in rainfall patterns have been directly linked to this decline in vector population. And so we see that climate change has a very important part in this decline. However, we are very careful to say that it's not the only factor.
Leading researcher Professor Dan Merovich is with the University of Copenhagen. He elaborates on other possible reasons.
Although the rainfall pattern has changed over these years, we don't think that can entirely explain these rapid declines. We assume that there may be other factors in play. It could be a disease among the mosquitoes. It could also be a change in use of agricultural pesticides in these communities. Because the interesting thing is that there has been no systematic attempt to control mosquitoes in these communities. So there have been no major intervention targeting the mosquitoes. So, but despite that, we observe this very rapid decline.
Scientists say if the mosquito decline is a direct result of climate change, other changes may occur, and not all of them will be advantageous. Last month, Tanzania's capital, Dar es Salaam, witnessed its heaviest rains since independence. Observers say extreme weather events are becoming increasingly common across the region. There are also worries that in areas where the mosquitoes have disappeared, resistance to malaria could decline. But for African health workers like Dr. Malesela, The disappearance of mosquitoes is good news.
We link that to a decline in malaria, which is definitely a very, very good thing, particularly that these are vectors of malaria, specifically Anopheles gambiae and Anopheles funestus.
Countries such as Eritrea, Rwanda, Kenya, and Zambia have also shown a dramatic reduction in mosquito numbers and associated cases of malaria. There is, as yet, no consensus within the scientific community as to why. A total of 11 countries in Africa saw a reduction of more than 50% in either confirmed malaria cases or hospital admissions for the illness. The World Health Organization says better budgets for fighting malaria in Africa has been a key factor in the reduction in malaria death over the past decade.
And that's some good news there, isn't it?
Really good news, Linord.
Yes.
Thank you so much.
Sure.
And Linord always has informative health news for us every Tuesdays and Thursdays here on In Focus.